All right, so we want to cover nerves on the posterior abdominal wall, right? So I'll do them in the order that they're shown here, right? For example, we can see the subcostal nerve here. I think you've done thorax before, and you know intercostal nerves were 11 in number. Then the 12th thoracic nerve, the ventral ramus of the 12th thoracic nerve, it wasn't going to be called an intercostal nerve because it's not in an intercostal space. So that's what we would call the subcostal nerve here, right? And as you can see, it enters the abdomen behind this lateral arcuate ligament, right? Then it runs downward and lateral, as you can see on your quadratus lumborum muscle here. This medially is the psoas major. So subcostal nerve enters the abdomen behind the lateral arcuate ligament, runs downward and laterally on your quadratus lumborum muscle, right? And it, as you can see, it reaches the lateral margin or the lateral border of your quadratus lumborum muscle here, right? Then it goes into this aponeurosis that you see. It's going to pierce this aponeurosis here, right? And that's the aponeurosis of the transversus abdominis. So a recap: subcostal nerve is anterior rami of the 12th thoracic spinal nerve. It enters the abdomen behind your lateral arcuate ligament, which comes from the quadratus lumborum muscle fascia that covers it. Then it runs downward and lateral on the surface of the quadratus lumborum to reach the lateral end of the muscle where it pierces this fascia here, which is the fascia of the transversus abdominis. Remember, when you were doing the anterior abdominal wall, you'd say that the muscles on the anterolateral side, which were external oblique, internal oblique, and transversus abdominis, they were going to be innervated by intercostal nerves T7 to T11 plus the subcostal nerve. Right, that's how the subcostal nerve will reach those muscles. Right. Then we have something that we call the lumbar plexus. So most of the nerves here that you're now seeing here, 1, 2, 3, 4, 5, 6, these are going to be branches of the lumbar plexus, right? So how do we form the lumbar plexus? Lumbar plexus is formed by the union of ventral rami of L1, L1, L2, L3, as well as a larger part of L4. So we basically then say L1 to L4. But it's not limited. It's not the entire L4 that's going to form the lumbar plexus, because a very small part of that L4 will go and contribute to the formation of the sacral plexus in the pelvis, right? So your lumbar plexus is ventral rami L1 to L4. It's formed on the posterior abdominal wall, and the nerves that are formed from that ventral rami, they emerge on either sides of the psoas major. Right. So last time when I was talking to you guys before I got cut off, I say that your lumbar plexus has 4 branches that emerge on the lateral side of the psoas major. Then 1 branch on the anterior surface of the psoas major. Those who are just joining us, we're talking about the lumbar plexus. And so far we've told you that lumbar plexus is formed from ventral rami of L1 to L4. And once you form it from ventral rami L1 to L4, you go further on to say that of the branches that are going to emerge on the on your lumbar plexus, they emerge on either sides of the psoas major. So I was saying there are 4 that come from the lateral surface of the psoas major. There's 1 that comes from the anterior surface. Then there is 2 from the medial surface, right? Right. Then L4, we remember L4. I said it's going to be part of both. It's going to be part of both your lumbar plexus as well as your sacral plexus. So it somehow connects. It somehow connects my F is bad. It somehow connects the lumbar plexus to the sacral plexus. So we call it the nervi focalis somehow, meaning the connecting trunk. If you ever see this word, it's just referring to L4, because L4 is common to both your lumbar plexus and your sacral plexus, right? So what are the branches that are coming off on the lateral side of the psoas major? We have iliohypogastric, which is coming from L1, ilioinguinal, which is also L1. Then we have what we call the lateral cutaneous nerve of the thigh, which is shown here. Lateral cutaneous nerve of the thigh will be L2, L3. Then we have the largest branch of the lumbar plexus, which we call the femoral nerve, which will be L2, L3, L4. Right, so the 4 branches from the lumbar plexus that emerge on the lateral surface: iliohypogastric, L1, ilioinguinal, L1, lateral cutaneous nerve of the thigh, L2, L3, femoral nerve, which happens to be the largest branch of the lumbar plexus, L2, L3, L4. Right. Then the one branch that I said comes off this one, comes off the anterior surface of the psoas major. We call it the genitofemoral branch. Genitofemoral branch, meaning it is a genital branch going to the genitals, it is a femoral branch going to the thigh. Right. That's how we call it genitofemoral. This will have nerve roots L1 and L2. Right. Then on the medial aspect, on this side there is no, but then we can use the other side here. On the medial aspect, there is the obturator nerve, which will be going to the inner thigh. The nerve roots of the obturator nerve are the same as the nerve roots of the femoral nerve. So it's also going to have L2, L3, L4. Right. Then another branch coming from the medial surface of the psoas major, we call it the lumbosacral trunk. Lumbosacral trunk will be going to join the sacral plexus. It carries L4 and L5, such that when you start the sacral plexus, you say there's L4, L5, then S1 to S4. Unlike the lumbar plexus, which is just L1, L2, L3, L4. Right. So one would be wondering why we said femoral nerve and obturator nerve both have nerve roots L2, L3, and L4. Right. What simply happens is these nerves, they divide into what we call divisions. So there is the ventral divisions and there's the dorsal divisions. The ventral divisions of L2, L3, L4, they join to form the obturator nerve, right? Then the dorsal divisions of L2, L3, L4, they join to form the femoral nerve. And that's how you end up saying they are both L2, L3, and L4, right? So where are these nerves going to innervate? Let me remove this. Okay. So in terms of innervation, this plexus is mixed. It does have some bit of sensory, some bit of motor as well, right? For example, we've talked about iliohypogastric here. You can appreciate that the iliohypogastric nerve. So if you look at iliohypogastric, it is a lateral cutaneous branch and an anterior cutaneous branch, which is typical of an intercostal nerve, right? But then when you then look at other nerves, for example, ilioinguinal, I think you can see where it's coming here. Inguinal is going to the inguinal region, right? Then lateral cutaneous nerve of the thigh, the name is self-explanatory. It's coming to the lateral side of the thigh. Femoral nerve, on the other hand, is the nerve of the anterior thigh. So all muscles in the anterior thigh compartment are innervated by the femoral nerve, as well as the skin on the medial side of the thigh, as well as the anterior aspect of the thigh, via the medial and intermediate cutaneous nerves of the thigh. Right. Okay, then genitofemoral. Genital means it is a branch going to the genital skin, the scrotal skin, the skin of the labia. Then femoral, it also has a cutaneous branch coming to the skin on the anterior aspect of the thigh. Right. Okay. Then obturator nerve, it innervates part of the skin of the medial thigh, but it also innervates muscles of the medial compartment of the thigh. Right. So having known this or done this, it also becomes important to realize that these are not the only nerves that you have within the abdomen, right? We also have the autonomic nervous system, which is made up of parasympathetic and sympathetic, which ultimately goes to the organs, right? Because of the visceral control. So for the purpose of abdomen, we talk about a lumbar sympathetic chain. Just like how in the thorax, there was a thoracic sympathetic chain, in the neck, there was a cervical sympathetic chain. So you have the same arrangement in the abdominal region, just like this becomes the lumbar sympathetic chain. Right? Why are we calling it lumbar? So the lumbar sympathetic, I think you can see here, it's on either side of the lumbar vertebra. The aorta in the middle there is sitting on the lumbar vertebra. So this is your sympathetic chains here. Right? You can see that they run vertically downward on the bodies of your vertebra in that region. Right? Then in terms of branches, it's still the same. You expect white rami communicantes. You also expect gray rami communicantes. Right? I won't dwell much on that. Then we also have lumbar splanchnic nerves. Right? And parasympathetic in the abdomen, for foregut and midgut derivatives, the parasympathetic is the vagus nerve. Then the hindgut and the pelvis, the parasympathetic becomes what we call pelvic splanchnic nerves. So you also have pelvic splanchnic nerves. Right. Questions so far? It's nice to ask, eh? Or where you want me to repeat?
Yeah, strategy. Ndambo Buddha, Famamshara my nails that are lateral to the source, major, anterior, and medial. Can you repeat?
So lateral we said ilioinguinal, iliohypogastric, lateral cutaneous nerve of the thigh, and the femoral nerve. Medial, there is the obturator nerve as well as the lumbus sacral trunk. Then anterior, there is the genitofemoral nerve.
Okay, thanks.
Okay. More questions? Then you also need to look up the various plexuses that you have on the posterior abdominal wall. For example, there's a celiac plexus, there's an aortic plexus of nerves. There are a whole host of plexuses in the abdomen that you need to find out what's feeding them and the likes. Right. And there's also this concept that I want you to get. So we have what we call the greater splanchnic nerve, which is T7. T7, why am I missing this? T7 to T9, then T10 and T11, they form something called the lesser splanchnic. Then T12 is the least splanchnic. Right. Okay. Those are some of the nerves that you refer to when you're doing your lessons, right? Especially for nerves. Right. Then we can also do a sympathectomy for treatment. So we can do a lumbar sympathectomy, where you remove some of the lumbar ganglia, right? Okay. Any other question?
Najibu, splanchnic nerves up. Mandiras.
Beta splanchnic, T7 to T11. T7 to T9 rather. Sorry about that. Then lesser splanchnic, T10, T11. Then least splanchnic is T12.
Thoracic nerves, what you got?
Oh yeah, there are thoracic nerves coming to the abdomen.
So, concept of splanchnic, where is it coming from?
What does splanchnic mean? What does splanchnic mean? It simply means related to the internal organs, or related mostly to abdominal organs. So they are going, because remember, sympathetic outflow is thoracolumbar. So thoracic nerves and lumbar nerves carry sympathetic. Right. Okay. What else? So we also talk about something called the celiac plexus. Yeah, this region here. That is labeled here. There's a celiac plexus, that is celiac ganglion. Okay. Anything else? Then this is the diaphragm. Innervation for the diaphragm. If it's for the muscular part, it's only the phrenic nerve. Okay.